The 9th annual Gun Violence Awareness Day has passed without any significant changes to the nation's gun laws. U.S. health and advocacy groups ask people to wear orange to mark the day in remembrance of shooting victims. Bright orange is traditionally a color worn by hunters.
Here to talk about the ongoing threat for kids is Dr. Cornelia Griggs, a pediatric surgeon at Mass General for Children. Doctor, thank you so much for joining us this morning.
Thanks for having me.
As you know, Massachusetts already has one of the lowest rates of gun violence in the U.S. But in your opinion, what can we be doing better?
Sure. I think there's a lot to be proud of in Massachusetts, having some of the lowest gun deaths in the country. But our community partners tell a different story. Those events and episodes of gun violence and deaths happen disproportionately in vulnerable communities. And that's where we direct a lot of our research efforts and organization.
You're typically the first person to tell a parent whether their child is going to survive their gun injuries or not. What should we know about those painful conversations when a life can't be saved?
Telling a mother that we were unable to save her child's life when that child has been shot is without a doubt the worst part of my job. And it's originally what inspired me to get involved in gun violence prevention advocacy and to do this work at our Gun Violence Prevention Center at Mass Gen.
Well, many people probably are wondering, how does this end up happening to a child? Is there any common thread to the stories of how children become injured? And what do you want people to know? What do you want parents to know?
Yeah, when it comes to gun violence in children, it's a combination of easy access, hot feelings, or a sense of despair, and really being affected by community environments. And that's something that we think about a lot when we're partnering with our community partners in systematically vulnerable communities where gun violence has become a part of the background of daily life. I think it's easy to think that gun violence is a problem that might not affect you, but what we see in the hospital is that when a child is shot, it devastates families. It sends ripples throughout the communities and throughout the state. And it's devastating as a healthcare worker to take care of a child who has been shot. And that's why we do this work and why doctors have to be activated to prevent gun violence.
And how do you plan on doing that? What is your strategy for helping to prevent gun violence in this case?
Sure. So I'm the director of education at the Mass General Center for Gun Violence Prevention, and we train every intern who comes through Mass General how to talk to patients about firearm safety storage, how to talk about red flag laws, ERPO laws, how to look for people who are in distress, and how to answer questions when people and patients in the community have questions about how to prevent gun violence.
Our first responders do so much more than what we think they do, in the hospitals. Thank you so much for what you do. Dr. Cornelia Griggs, a pediatric surgeon at Mass General for Children. Have a good Saturday. A safe one, too.